Inhalers are a daily part
I keep these with me 24/7.
of Joyce Coggin's life.
I have chronic bronchitis and asthma.
The problem is, with no insurance,
Now, this is my emergency inhaler.
she doesn't always have the money to buy them.
You can actually pass out from it, and that's what's happened to me before. I have actually passed out.
That could change in 2014. Coggin is likely eligible for Medicaid expansion, assuming Tennessee takes part. The Affordable Health Care Act initially made it unlikely any state would opt out because that would mean losing Medicaid funding.
And when they signed up for Medicaid, they could not have ever anticipated that this type of expansion would occur.
Vanderbilt law professor James Blumstein filed a brief opposing that provision of the law with the U.S. Supreme Court, saying, among other things, it's unfair to states.
And I said that was coercive, A, and B, that the states couldn't foresee this, that they didn't have notice, and that under the Constitution, the states are required to have notice of the obligations that they incur.
The Supreme Court agreed, leaving the future of people like Coggin in the hands of state lawmakers.
Tennessee has a choice to make.
Health advocates like Kristin Ware say the state would be foolish to opt out of Medicaid expansion because the federal government would be paying almost all of the cost to insure people like Coggin.
Tennessee is merely paying 10 cents on the dollar to ensure that people who need health care the most are getting it.